Hello and welcome to another session of Max Doc Talk. This Asthma Day, we have the chest expert Dr. Sharad Joshi, Associate Director, Department of Pulmonology at Max Super Speciality Hospital, Vaishali, to discuss on the topic environmental pollution and asthma. Hello, sir.
Hello.
We all know that asthma is a lung disease that makes it harder to move air in and out of your lungs, and pollution is a trigger that worsens the asthma. So, this brings us to the very first question. What environmental factors contribute to asthma?
So, asthma is a disease which is heterogeneous. So, there are people who have genetic predisposition for allergic response. So, this is an abnormal immune response to certain allergens which are present in environment. It can be dust, it can be pollens, it can be fungi, or it can be bird denders or anything like that. So, these kind of allergens stimulate overreaction of your immunity, and that leads to asthma.
This leads to our next question. What are the most common asthmatic triggers?
So, in a genetically susceptible patient, dust storms, change of weather, change of temperature, pollination, or autumn season, these kind of things can trigger asthma. But recently we have seen that there were patients who never had asthma or asthma-like symptoms, but after COVID recovery, they developed symptoms similar to very close to asthma. So the entire complete etiology is still not explained, but definitely pollution is also one of the component which leads to development of asthma.
Speaking of pollution, does air pollution affect asthma?
Certainly, the air pollution does affect asthma. It leads to more and more higher incidence of asthma, even in patients who are not genetically had susceptibility or who don't have a family history of asthma in their family.
Okay, so Dr. Joshi, can indopollution cause asthma?
So there are different hypotheses which were proposed for development or etiology of asthma, like Dutch hypothesis. Then there was a hygiene hypothesis. So it was considered that people who live in a very clean and hygienic environment, they do develop asthma. So what happens is that our immunity in the initial phase of life, when it is exposed to bacterial infections, the immune direction changes. If our immune system is exposed to lot of viral diseases during childhood, lot of allergens during childhood, then the immunity develops in a different manner, and that leads to development of asthma. So if we talk about indoor pollution like burning incense or using chemical cleaners or something inflammable, these kind of things can definitely lead to generation of asthma.
And is it possible that one can develop asthma later in life?
Yes, certainly. Because a person was very stable, say in North India, and because of occupational reasons, because of anything, he migrated to some other country or some other region of your country. And because of presence of some other vegetation, like the presence of Congress grass, which is a plant. So if patient gets allergic to that particular pollen or a plant, he will develop asthma in later stages. So even the viral infections, they can trigger certain immune changes in your body, and the person who was not asthmatic earlier can react or can actually behave like an asthmatic person later on in their life.
Interesting. This brings us to the next question. Is asthma an autoimmune disease?
So precisely speaking, no, asthma is not an autoimmune disorder. We need to understand that immunity is a double-edged sword. So whenever a person has lower immunity, he is exposed to or he can get lot of infections repeatedly. If your immune response is hyperreactive, then your body will react to certain allergens, certain stimulants abnormally high, and that leads to allergy, hypersensitivity, or asthma-like symptoms. So immunity low is also dangerous, immunity high is also dangerous. So a balanced immune system is actually what we need. But a hyperreactive immune system will definitely lead to asthma, but it's not an autoimmune disorder.
And what are the symptoms of asthma?
So generally speaking, it's like chest tightness, breathlessness, wheezing, cough. These are commonest symptoms of asthma. But there are variants of asthma where in a cough variant asthma, patient will have predominantly cough as a symptom. Maybe wheezing is absent and breathlessness is less, but dry cough can be one of the symptoms. So generally speaking, cough, then breathlessness, chest tightness or feeling of congestion, wheezing, these are main symptoms of asthma.
Okay. So, who is most likely to be affected by asthma?
So patients who are atopic, people who have family history of asthma or skin allergy or atopy or any kind of allergic disorders, they have tendency to develop asthma after exposure to certain environmental stimulants.
What is the most suitable environment for asthmatic patients to live in?
So now we have seen that what causes asthma and what is the etiology of asthma and what other air pollution contributes to asthma, viral infections contribute to asthma. So a ideal environment for an asthmatic will be a trigger free or an allergen free environment. For that they can have a clean house, they can plan for arranging a air purifier at their home and that can help them. Every person or every asthmatic person, every allergic person has to recognize what is the trigger of their asthma. There are people who develop asthma after exercise or during exercise. So that is called as exercise induced asthma. So if your exercise or exertion is the trigger for your asthma, definitely you have to take your medications and bronchodilators and inhalers first and then you start exerting. Similarly, if you think that okay, the March and April is the transition season when because of dust storm, because of pollination, because of the autumn, you get triggers and you get asthma, then definitely you start your anti-allergics before the season starts for it. So that is the ideal environment.
When we talk about environment, we are living under the new environment since the last 2 years where we have this virus COVID. Since COVID is uprising, are there any particular preventive measures to be taken by asthmatic patients?
Look, we need to understand that COVID or for that matter any viral infection, it's an aerosol or air generated infection. And best preventive measure is keeping the social distancing, wearing your mask, double your mask if you are going to polluted areas or crowded areas, and that's the best way to get rid of or just save yourself from these COVID infections or viral infections. Because any asthmatic or a patient who has pre-existing respiratory illness, they are at higher risk of severe COVID, severe infections and lot of complications. So prevention is definitely going to be better than cure. And the prevention remains same: hand hygiene, social distancing and wearing your mask.
And lastly, sir, what are the treatment options available?
So when we talk about asthma or treatment of asthma, there are multiple medications. There are oral medications for it, there are inhaled medication for it, there are nebulized medication, there are injections as well for emergency situations. First thing, avoidance of allergen. Identify the trigger of your asthma, whether it is dust in your carpet, whether it is pet and their danders in your home, whether it is indoor pollution or outdoor pollution, that needs to be recognized, and allergen avoidance is one of the best part of the treatment. Thereafter, the second most important and effective option is inhaled medication. Unfortunately, because of illiteracy, because of poor knowledge and information, many people of asthma actually avoid inhalers. They do ask one question: sir, I will not get addicted to these inhalers. So that's an idiotic question actually. Inhalers are there to open up your airways which are congested, they are narrowed because of your asthma. So it is very important to adhere to continuously and regularly take your asthma medications as per the guidance of your doctor. And inhalers are good, whether it is dry powder inhaler, it is metered inhaler, or whether it is nebulized medicine. This is all here to help you.
So lastly, any message that you would like to give our patients or the people who are viewing this live?
It is good to breathe a fresh air. It is good to breathe an air which is pollution free. Coincidentally, we need lot of air in 24 hours. We can filter our water intake according to our needs, but we cannot filter the entire air we need during 24 hours. So keeping your pollution levels low, keeping environment clean, and using all the precautionary measures is the most important aspect of control of asthma, of prevention of COVID and COVID-related asthmatic exacerbations. Thank you.
Thank you, sir. That was very informative. So, friends, if you have any question on asthma, please feel free to add it in the comment section and we will get back to you at the earliest. If you want to book an appointment with our doctor, then you can call on the number on the screen or can simply click on the link in the description and book it online. Thank you so very much, sir.
Thank you.
And I hope that it was an informative session for all of you as well. Stay connected with us to get on another session of Max Doc Talk. Thank you so much.